A very good afternoon to all of you present here in this webinar. It is great pleasure for us today to have Dr. Sindhu Thomas ma'am who would be presenting and talking to us about tool validation. Let me give you a brief about this young and dynamic personality. Dr. Sindhu Thomas is a very renowned social person whom we see on social media, especially on her YouTubes and other things. Madam has done her BSc Nursing from Manipal College of Nursing. She has done her MSc in Child Health Nursing from MGM Institute of Health Sciences. She has done her MSc in Counseling Psychology from Institute of Distance Education, Kurla, and Madam has also pursued her PhD from MGM Institute of Health Sciences, Navi Mumbai. Madam is a member of various professional bodies like the Nursing Research Society of India, the Maharashtra Nursing Council, the Karnataka Nursing Council, and Trained Association of India. We see that Madam has not only limited herself to nursing but also has done many courses apart from that. She has done the e-learning on GFATM in 2017. She has also done a course on first aid management from St. John Ambulances in 2009. She has completed a certified course of 6 months diploma in counseling in 2008. If we go for the awards and recognition, Madam has got many awards, right starting from research to academics. She has done various paper presentations, various oral presentations also, and she is a dynamic personality as far as research also is concerned. She has done research in various areas pertaining to nursing. Currently, Madam is working as the assistant professor in MGM New Bombay College of Nursing. She is also an active member in the COVID management team. She is a skilled counselor focusing on adult and teenage issues, and she's a certified parenting coach for pediatric age group. We welcome you, ma'am, to this webinar. Welcome to Parul University. It's a pleasure to have you, ma'am. I hand over to you, ma'am, for the informative session. Please take over, ma'am.
A warm good evening to one and all over here, and it's my pleasure to be a part of the webinar what is hosted by Parallel University. So greetings from myself from personal side as well as from MGM Health Sciences as well as my college that is MGM New Bombay College of Nursing. And I got this opportunity through Sanjay sir, and we have connected during our presentation, and it's a pleasure that we are in a give and take relationship. So to everyone over here, once again, I would like to extend my thanks to call me over here. And the topic for today's webinar is on tool validation. So coming to the objectives, so I asked the concerned person who all are the audience over here. So they inform me from BSc onwards till PhD program are there with this particular program. So I touched from the what base to a little higher extent. So these are my objectives for the same. So by the end of the webinar, each participant defines the term validity of research tool, enlists the types of tool validity, describes phase validity, explains the content validity, lists down categories of criterion validity, comments on construct validity, and I have highlighted on the reliability of a research tool. Coming to the topic where the term validity comes in research. When we talk about research, especially in third year or if you are talking the master's program from first year onwards, we are learning research, and in PhD program, obviously we are into research as such. So once the initial thing that is based on the terms and condition what our institution needs or based on the social needs, we raise up the research questions. From the research questions, with the help of the guide and other important members of the committee, we come up with the research statement. From the statement, we come up with the objectives, thereby hypothesis of the study. Then we develop the research methodology. When the research methodology is explained, especially we put it across this research methodology in our research proposal. There we come up with the development of the research tool. And once the tool is developed, we go for a validation of the tool, thereby the reliability. Obviously, a person who conducts research for the first time, he or she can be amateur. So we will take the help of the experts, those who conducted the research more than 2 or 3 times. Coming to the concept of validity, so we develop a tool once we are clear with our problem statement, we come up with a tool. So once our tool is ready, then the next step is to develop a criteria for validity, and we need to check the reliability. So in short, whatever the tool the researcher has developed is providing answers for the research questions what initially quoted in this particular previous slide what I've shown. If so, is it developed in an accurate method? This is what we are going to see with the concept of validity. If you see, the validity and reliability are two main concepts. We try to evaluate the quality of a research mainly with the quantitative research. Coming to the concept of validity. What is validity? Validity is the degree to which an instrument measures what is supposed to measure. It is a very common definition given in Porridge and Hungler. In short, what I want to say is the the validity, whatever we are going to do is an instrument. Here I have shown a picture of an instrument. We use a thermometer. Nowadays, this thermometer is very regular once the COVID has been into picture. So we are using a thermometer to check the temperature. We are using a sphygmomanometer to check the means BP of a patient. So when a biophysiological measurements are coming into concern, these instruments are in picture. But when we as a researcher, I and you need to assess the knowledge or the skill or any kind of illnesses like depression or anxiety, any nature has been developed. If I and you as a researcher need to develop some tool, it can be a questionnaire, it can be a Likert scale, or it can be an observation checklist. Whatever we are developing by the researcher, then the validity comes in picture. Let's see what are the types of validity we can check in. So the different types of validity is the face validity, content validity, criterion validity, and construct validity. So coming to the first is the face validity. I would say when you get a question paper or if you get a paper with any kind of tool, you hope you know what are tools. There are different types of tools are there. There can be questionnaires or it can be interview schedule or it can be a rating scale, observation checklist, anything what we are using. The mainly expert will check into what is the validity what we can come up with. So the face validity is an overall look of an instrument regarding its appropriateness to measure a particular attribute or a phenomenon. So mainly the experts will look into the appearance of the tool. For example, if we take a problem statement that now the schools are reopening after the COVID protocols has come in and it is very strictly they are checking into the COVID prevention protocols. If you see these protocols, they are mainly looking into the observation checklist. We develop as a researcher, I develop an observation checklist. So I need to check that whether the hand washing facilities are available, are the children wearing a mask, or is the social distancing between the chairs of the class are there. So these things need to be there as a point for the protocol. So as an expert, a second party or the expert of that particular subject can look into is an observation checklist is good enough to assess the COVID prevention protocols in the school. So hope this face validity is clear. We will also call it as a logical validity. That is, we are looking into logics that to check the protocol of COVID, it's better a person as an observer go and check is the schools are doing because the municipal corporation or the government people or the government officials are supposed to visit to the schools to check whether the protocols has been maintained. This is the weakest but the easiest way of validation. I have given another example as a picture. Rate your level of agreement with each statement. So here we have a Likert scale where it is strongly disagree, agree, neutral, agree, or strongly agree. So it is given chocolate ice cream is delicious. So do you agree or no? So you are given a five rating scale is given to you so that you are able to mark it. The second item is chocolate ice cream is satisfying. What is your rating on the Likert scale? And chocolate ice cream is indulgent. So based on your opinion or the way you are agreeing with this particular concept, a tool has been developed. So the face validity is we are checking the items is good enough to assess what the researcher want to check in. Coming to the content validity, mainly in nursing we go for a content validity, whereas the adequacy of the content, that is the items are there. Suppose I want to check the some practices I need to check that the if example I need to take the breastfeeding practices. If I develop a checklist, the as an expert or the expert committee need to check the adequacy, is the tool appropriate and is it complete or only some part of the breastfeeding is taken care by my tool. So the next point that content validity need to be covered is the scope of coverage of the content need to be measured. So what we need to do is usually we give to the experts a minimum number of 15, 10 to 15 experts will be given with the tool what the researcher has been developed so that the experts can tell is this content adequate for the for assessing that particular data. Usually, the nursing students go to different colleges or schools or institutions where they will have the experts of the subject and they will give for validation that the data has been given. And nowadays, a validation committee is also in picture whereas experts of different areas can be taken care. Suppose a pediatric topic is there, pediatricians can be there, the obstetricians can be there, or the community people, that is social worker can be there to see the feasibility of the study. I would really recommend a statistician should be there so that how the tool need to be assessed by the end of your research study can be checked by the statistician. So whatever tool you are developing and once you give to the statistician, he can put his input whether this tool can be assessed by which test and how your answers will be. That's why the first statement that from the objectives, your hypothesis is clear, and once the hypothesis, your methodology is clear, and by having a tool validity, you are very clear that what test you can use for this kind of model or this kind of tool I'm going to use for my research study. Another important point we can see in this content validity is the CV ratio, that is content validity ratio is the numeric value indicating the instrument's degree of validity by the expert's rating. The rule of thumb is if the CVR is more than zero point 0.7, the item of the scale is considered as valid. So I quote an example over here for the content validity is we have different content. So again, I can go for a Likert scale with four numbers. That is item number one is irrelevant. That is the score number one is it is an irrelevant item. Second score is somewhat relevant. The third one is most relevant, and the fourth one is extremely relevant. So each item can be check for the CVR ratio and we can come up with. So item one, if 3 experts rate 2 and 7 experts have come up with 3, the score 3, what I have explained it before, we can take that 7 out of 10 has come up with that it is a better or a mostly relevant item. So the CVR score can be developed by 7 out of 10 because maximum we give 10. 7 out of 10 people said or the expert said that excuse me. I'm sorry. The item number one is mostly relevant. So the CVR ratio can be called as zero point 0.7, which shows that the item number one is relevant. Second item also same thing. One example is given that one expert rated the item as 2, that is somewhat relevant, whereas 9 experts rate that it is mostly relevant. Again, CVR can be calculated 9 out of 10, so it will come as zero point 0.9. The third item, that is, these are the items of a tool, what we have already developed. In this 10 rating, 10 people or the 10 experts rates the item 3 as 3. That is mostly relevant. The CVR can come as 1. This way, the each item in your questions can be validated and you can come with a CVR ratio. Hope this is clear. So next we are going to the criterion validity. Criterion validity is something else to be told when we talk about this particular thing. So criterion validity measures how well one measure predicts an outcome for the another measure. So it also shows that how the measure of an instrument with some other external criteria. To come with an example, suppose I or you want to check the professionalism among nursing staff. So we may make a checklist or a questionnaire based on the content what we got on what is professionalism in nursing. Along with this professionalism questionnaire or any opinionaire or attitude you are going to check among the staff nurses, we can also ask them how many conferences they are attending in an year, or recently how many they have attended or being participated, and how many papers they have published. So the value or the score, what you're getting from the tool, you can relate or correlate with the number of conferences or how many papers you have been published. So from there, you are able to identify the R value. And if the R value is more than zero point 0.7, you can come up with a good criterion validity. And the next point in criterion validity, what I want to say is this criterion validity can help us in identifying actually three things. That is, we can relate our tool with the past, present, or the future. But past, we really don't put it into picture. Based on the present and the future, there are two subcategories for a criterion validity. They are the predictive validity and a concurrent validity. Coming to the predictive validity. If you speak about a predictive validity, this validity or the test accurately represents what is going to predict. Example, there are, you know that there are some personality tests and career tests for once you complete your 10th and 12th, so that what profession you need to come in later life can be identified by taking this career test. Same way, we know that there are entrance tests for almost every colleges to take the student. So the entrance test score is the prediction for your first year GPA, that is grade point average. So this way, your test score can be related with the performance of the students in the first year, or basically once the child has gone into that particular career. So this is mainly this predictive validity put into. So a predictive validity is highly significant when the values what you are going to come up with, that is the test you are giving to the child, and we are able to understand which career the child is fitting into. More than that, the personality test also help us to understand that how the person is going to face the life in a near future or a far future. So predictive validity mainly work on this particular aspect. The second aspect of criterion validity is concurrent validity. Concurrent validity will be taken care when two assessments need to be taken care, and how these both two are related. Suppose as a researcher, I develop a tool, and what I can do is I can make sure that is my tool developed is good as a highly recognized or well established tool. So for example, I have given us Wechsler's IQ test is a very known psychological test. And if I develop a test, it's given a test named the Victoria Super Duper Intelligent Test. Suppose the researcher developed it. So the researcher want to compare the developed test with the Wechsler's what is highly recommended IQ test. Then this test will be correlated and the values will be taken care in the concurrent validity. I would like to explain again the criterion validity. Criterion validity is the validity when the researcher want to check the validity with some external criteria. Okay, it is not the criteria what as a researcher I need to set in. I need to develop a tool and I need to validate my tool with another criteria. So we had come up with an example of professionalism among staff nurses. So what we are doing is, as a researcher, I develop a tool. So with that tool I can also ask them what are the conferences they attend or how many research papers they have published. With this, I'm able to understand that an external criteria is the published papers or attending the conference. And the tool what I've developed can be correlated to see what is criterion validation. Hope you are clear with criterion validation. It is also check or we are able to understand the validity of a test in the near future or the present. Based on this, we can subdivide the criterion validity into predictive validity and concurrent validity. And the predictive, and one more thing is past, there is post-predictive validity, which is not much useful in medical science. Coming to the predictive validity, just give me 1 minute. Predictive validity is something to predict. So that means I develop a tool and I need to make sure that, but suppose an entrance test, the teachers are preparing a tool. The tool will tell you whether the students are fit for this particular profession. This is called predictive validity. We can also think about some personality test or some career guidance test so that by 10th and 12th, the children are able to guide which profession they need to take up. Coming to concurrent validity is mainly with the research aspect. When you speak us, I develop as a researcher, I develop a tool and I need to make sure this has same standard as a well-established tool. Suppose I develop a tool to assess the level of consciousness. An highly established tool for assessing the level of consciousness is GCS scale, Glasgow Coma scale. So I can compare how my tool is accurate and well developed basing the GCS what is already developed as a golden standard or a set standard. Hope the concurrent validity is also clear. Coming to the construct validity mainly deals with whether the assessment is measuring the correct construct. That means I need to develop some construct. In short, the construct validity is something to do with the theoretical aspect. If I need to develop a tool, there can be subheadings. So this is called construct. So I can develop construct when suppose I have an item of 20 or 30 items are there in my tool to assess. What I can do is I can make construct and based on the construct I can go for subscales under the main tool with the 15 or 20 items what I have. Then I can divide the tool on these sub points. So I put it with an example that the coping inventory for stressful situation, that is CISS, is a psychological scale, a four-factor model of human coping. That means how a person coping to any kind of stress. This is the CISS model given by Endler and Parker. So Endler and Parker, this tool is a developed and a validated standardized tool. But before this tool has been standardized, when the person, this particular people has developed this tool, they administer to college going students and the adults. So once they develop and give the tool to this many students and this many adults, they are able to identify what are the different subheadings they can come up with or what are the construct they can come up with CISS tool. And based on that, there are main three constructs are there or main three subheadings. We are able to identify the coping mechanism of people as the emotion oriented. That means there are people emotionally cope up with any kind of trauma has happened or any kind of issues has happened. So the emotion oriented people will deal accordingly. There are some kind of people that is task oriented. That is they will take the task. They will go face it. Suppose someone loved person has expired, how you're going to face that particular thing. Some people are into emotions where they will come up, but their emotions stand up. Whereas the task-oriented people are a little more realistic, whereas they are able to cope up with the issue, but they are able to manage the task. But there is another subheading or the concept is avoidant type. These kind of people either can be distracted, they can play mobile games or distract themselves, or they can be socially involved so that the impact of pain can be reduced. So this way, this Endler and Parker has come up with an abstract. See, the construct validity is a little tough to understand. That's why I had taken up an example and how they had come up with the three abstract has been explained. Hope it is clear. So I think the content validity or the validity has been explained well. So I would like to tell about the validity again. Suppose the validity is something that we are going to measure, we are supposed to measure. There are mainly four types: face validity, content validity, criterion validity, and construct validity. Face validity, it is the weakest and the easiest type of validity, whereas a logical way of the validity is being assessed. That is, seeing a question paper, seeing a tool. As an expert, I should tell that is this tool is apt to assess the objectives, or is it as able to assess the questions what is framed by the researcher. Coming to the content validity, we spoke about the content validity. The experts are able to understand is the items given in the tool be able to cover up the entire aspect of the questions asked by the researcher or the objectives given in the problem statement. And we already discussed about the content validity score, how to rate the CVR. The ratio can be developed so that if the ratio, the thumb rule, if it is more than 7, we are able to say that each item in the tool is good or relevant enough to be the part of this particular tool. Coming to the criterion validity is the tool what we are developed. We are going to compare with some other aspects so that we are able to understand that even if my tool is there, I'm able to identify with some other aspects also. So the criterion validity also help to assess the present and the future aspects. Based on that, we have two subgrades, that is the predictive validity as well as concurrent validity. Predictive validity also we have explained how the test, that is the entrance test, can develop a idea about the student and how well he or she is able to come up with a good score in the upcoming years when they are going to for their career or the professional courses. Whereas concurrent validity is mainly something to do with the present, that as a researcher I develop a tool and I relate or what correlate or compare with the golden standard or the well set standard, so that I can tell that my tool or the tool what I develop is equally or developed well the way the golden standard has been kept. But the main problem with nursing researchers is the questionnaires. We cannot find a golden standard questionnaire where we can able to compare it. The next is construct validity. Construct validity is something to do with the theoretical aspect. Whatever hypothesis we have developed, we are going to check whether my tool is able to assess the construct what is developed. So I came up with an example how we can make the subscales based on the construct what my tool is going to represent. Hope the validity is clear. Even though the reliability is not being asked to represent, I had just put in a nutshell to see what is reliability, because validity and reliability go hand in hand. So when the validity helps to understand that my tool or the tool what the researcher has developed is able to identify the answers for the objectives or the questions what has been asked, the reliability helps to understand that the results what the tool has been produced is consistent. So the reliability is the ability of a tool to produce consistent and reproducible result. We always call it as pre-testing of the tool. Once the tool is developed, We always tell that the next is pre-testing. That is, we need to check the validity of the tool before the student of the researcher is going for a pilot study. Mainly three aspects we there in the reliability. The reliability of a tool can be assessed by any one of the aspects. I said there are mainly three aspects. Any one of the aspects, if our tool is able to identify, then we can say that the tool is reliable. So the first aspect is the stability of the tool. That means, is the tool what we develop is stable or no? So what we are doing is the tool produces the answers when it is used 2 or 3 times. Usually the questionnaires or the rating scales, we can go for test pretest method. That is, day one, I can go to the samples. That is not the real sample for my main study. Homogeneous group can be taken. That is, if the students are the nursing students are my samples, so I can take a homogeneous population from another setting I can do, and day one I give the questions or the questionnaire what is already established by the researcher, and again I can give the questionnaire on the 5th day or the 7th day, and to the same number of people. Suppose 5 students, I administered the question on COVID protocols if I have given, and on the 7th day also I'm going to give to the student the same students same questions to identify is the sample, that is sample number one, has given consistent answer on day one and day seven, or day one or day five. Hope it is clear. This way, how many samples I'm going to give? I'm going to correlate the day one values with the day 5 or day 7 values. So this we usually we go with test retest method, and we go for Carl Pearson's coefficient of correlation, whereas we identify the R value. If you see the R value of R value when you talk about the Carl Pearson, not like Carl Pearson's, R value is always between -1 to +1, and the minus sign always talk about the direction of the results when we depict or plot in a graph, whereas the value really shows that how reliable our tool is. And we know that the score is between 0 if there is no correlation, zero point 0.1 to zero point 0.3 shows that it's poor correlated, zero point 0.4 to zero point 0.6 shows that it is mildly correlated, and zero point 0.7 to zero point 0.9 is highly correlated, and the score 1 shows that it is perfectly correlated. Usually the tools we go for a high correlation, and if the correlation is not coming between zero point 0.7 to zero point 0.9, then the item need to be rechecked and modulated to make sure that the reliability will come as in between the range of zero point 0.7 to zero point 0.9. This is about the stability of the tool. Next is the internal consistency of the tool. So the internal consistency is all subparts of the tool measure same characteristics. Usually what we'll do is, suppose there are 1 to 10 items are there in my tool, or 1 to 20 items are there in my tool, I can take all the odd numbers together. Item 1, item 3, 5, 7, 9, 11, 13, 15, 17, 19 can be in one side. The other side have all the even number of items. So once you are done like that, I'm able to do by a method called split up method, and usually Cronbach's alpha formula will be used to identify the R value. The R value will be between the point one, -1 to +1, where the whatever explanation I spoke about R can be done in Cronbach's alpha as well as. The third aspect we need to understand is the equivalence. Equivalence means two different observers will parallelly check a phenomenon with the tool what is developed. So with this particular thing, we are able to relate the findings of the observer number one and observer number two. So this way we are able to identify the reliability of the tool. So any one of the stability, internal consistency, or the equivalence is taken care, and if the R value is coming between 0.7 to 0.9, we can tell that the tool what has been developed is reliable. In short, if you see how the reliability and validity has been taken care, this is a picture that shows the validity and reliability of a research data is given. So we know this arrow board, and we know that the center point is the place we are supposed to put the arrows. And mainly the points are the data points, and this can be seen as a scatter diagram. If you see a scatter diagram, so this represents a scattered diagram. So the first arrow board or the dashboard what is given us, the answers or the test what we have identified is reliable because the points are very nearby. But it is not valid. The whatever questions or the items in the question paper are consistent. That is, five people in two different times you are given the answers given by the participant number 1 to 5 are nearby. There is no difference in first day and the fifth day, but the questions are not clear. That's why it is not in the middle. The second dashboard shows that it has a low validity and low reliability. It is another scatter diagram where all the points has been scattered all along the dashboard or the arrow board. The third thing what you can see is it is not reliable and it is not valid. That means it is not, the point should be coming together. You know this particular the representation you can see in scatter diagram when we discuss about the graphical representation of various quantitative data. Whereas the last dashboard or the arrow board shows that all the points are in the middle. Whereas the questions are valid and the answers given by all the participants on different days or the different observers are coming to the nearby point. So the last picture shows that the data or the tool what is developed is highly reliable and highly validated. Hope the concept of validity and the reliability of tool validation is clear. So today we have done what is the concept of validity, and we discussed what are the types of validity of a research tool. So we spoke about the face validity, content validity, criterion validity, and construct validity. Coming to the face validity, it is very clear the expert is able to understand the tool what I develop. It can be a rating scale, it can be a Likert scale, or it can be a questionnaire. Is the questions or the tool what is developed is appropriate to the objectives what is developed or the problem statement. As I already mentioned, it is easiest but weakest. The second one is the content validity. Usually we go accordingly, whereas the scope of the content we are checking or the adequacy of the content of the tool we will be checking. And mainly we give our content to the experts. 10 to 15 experts will be given with the content so that they will be able to identify each item in your tool is good enough to understand or cover up the objectives what you have been developed. Other than that, a validation committee also can be taken care of the validation process of the research tool. Whereas I would say not only your subject, that is, I mean, say if it is a pediatrics, not only a pediatrician or a pediatric nurse, a community nurse can be involved, or an obstetrician can be involved, a community PSM department, preventive and social medicine person can be involved, whereas the psychologist can be involved and a statistician also can be involved, so that the committee is able to give the different views from their subject knowledge on our tool so that the items can be included or excluded. Also, we can develop a content validity ratio, that is a numerical value can be developed, and the thumb rule is if it is more than zero point 0.7, that item can be considered. So the content validity, how to identify each content, we can make a Likert scale with the 4 items, that is one stands for irrelevant item, and the second one is the somewhat relevant, third is mostly relevant, the fourth one is extremely relevant. So we are able to identify the item number 1 to item number 15 or item number 1 to item number 5 is good to assess the research question what is developed. Criterion validity is, we already discussed that, the whatever tool the researcher has been developed, we are comparing or correlating with an external factor. That is when we talk about some professionalism, it's good that the upgradation of the nursing can be done by the the conferences or the webinars. That is why all our nursing council is asking us to have credit points by attending, being a delegate or a speaker or be an organizer for a workshop or any other webinar, so that they are upgraded by these kind of criterion. So we learned that there are mainly two subtypes, that is a predictive validity as well as a concurrent validity. Predictive validity, we already discussed that based on the score what the tool has been developed, we are able to predict the future of the samples. For example, the entrance test, common entrance test, CET test can develop, make us understand, is the student capable to score better in the upcoming professional course or any other course. Concurrent validity is the validity something to do with the agreement of two assessment that is already there. Usually we compare the newly developed tool with a golden standard or well established tool. For example, I give that if I as a researcher develop an IQ test, I can compare with Wechsler's IQ test, which is already highly recommendable, and it is finding a good product. So I can say that my tool is comparatively likely or better like a Wechsler scale, so that this also can be standardized or validated for using in a public realm. Coming to the construct validity, we are able to identify or measure the behavior or the hypothesis what is expected. So I come up with what are the subscales. By developing a tool, we can make the subscales, or construct can be developed by having a construct validity. Coming to the reliability is we are able to identify how consistent is our results. Mainly three aspects we will be checking. We call it as pre-testing. Do not confuse with pre-test and pre-testing. Pre-testing is done before the data, before the data has been going for a pilot study. The procedure is known as pre-testing. Whereas pre-test is what we are doing is mainly with the pre-test process for a data collection, whereas before the intervention is given, we are going to identify what is the baseline data of the sample. That is known as pre-test. So the three main aspects to do with the reliability is, first one is stability, that is over a time period, is our tool develop the tool what we develop come up with a consistent answers. Usually we go with test pretest method. How we do is day one we give the test, and maybe on a day 5 or day 7 we are going to give the same test to the same set of students, and the R value can be developed with the help of Carl Pearson's coefficient of correlation. Mainly the R value, as I already said, the value can be between -1 to +1, whereas the 0 is no correlation, -1 is perfectly negatively correlated, +1 is perfect positive correlation, whereas the values from zero point 0.1 to zero point 0.3 says that it is mild correlated, zero point 0.4 to zero point 0.6 shows that it's moderately correlated, zero point 0.7 to zero point 0.9 shows that it is highly correlated. Coming to the internal consistency, what we can do is the items of the tool can be divided mainly with an odd number and even number, and using a split up method and using the Cronbach's alpha method, we are able to identify the R value. The third is the equivalent, that is two observers parallelly observing a particular phenomenon. Suppose breastfeeding, the sorry, one person and the second person can check on the mother and identify the tool what is developed by the two examiners, and the values developed by examiner number 1 and examiner number 2 can be correlated to see whether the R value is good or no. Finally, I come up with how validity and reliability are needed to identify the quality of a quantitative data. Hope the topic is clear enough. With this, I would like to extend my thanks for being a participant of the same with your patient listening. Thank you.
Thank you so much, ma'am. It was a very informative and a simplified content that you have presented. I'm sure that the students have benefited from this. Even I enjoyed, especially the examples were really relevant and enjoyable. Thank you so much, ma'am, for being with us. We look forward to have different collaborations with you. Thank you, ma'am. Thank you for the session.
Thank you so much.